let us look into some of the challenges that one would encounter in the Gen AI space for the healthcare. So the business challenge is to move from manual, inefficient processes to efficient, optimized, automated processes. We all agree. And we need to simplify the documentation process to avoid the burnouts. And we want to enable clinicians, physicians, specialists, caregivers, care providers, payers, all the stakeholders in the ecosystem to get the information that they need without any delay. So generative AI seems to be the answer. The healthcare is governed by stringent regulations and data privacy requirements. And the application of Gen AI has to be ethical, responsible, bias free, and explainable. Let me highlight a case of racial bias that crept into AI model. So this model helps the patients and insurance companies identify the patients for high risk care management program. And this program provides chronically ill people with access to specially trained nursing staff, and extra primary care visit for closer monitoring. And the model designers used patients' previous care spending as a reference for determining medical needs. And cost was deemed to be very efficient way to summarize how much healthcare needs someone has. And in reality, this model selected more white patients than black patients. Then the research was conducted to understand why. The research team studied approximately 50,000 patient records, of which 6,000 plus patients self-identified as blacks and 43,000 plus identified themselves as white. When you look at it, the model's risk score allocation was similar for all these population. However, in reality, 26% more black people deserved attention as they were suffering from chronic illness. So where is the gap? The cost spend may give an idea who needs more care, but model did not consider the visit patterns. The black patients tend to use the health facilities less frequently than the white population. They visited health providers when there was emergency due to complications. Because they recorded healthcare costs, they were on par with all the healthier white population. The model was very likely or less likely to flag the eligible black patients for the program. The model did not consider the other important features that could determine the desired outcome. So the biases can also occur when the models get trained with the skewed data. So how bias could affect the trust factor? There was a study conducted on how bias could affect the analysis capability of the specialists. So in a study involving around 450 doctors, nurses, physicians, assistants, they were shown the cases of patients hospitalized with acute respiratory failure. The clinicians were given patients presenting symptoms and the information about from their examinations and the lab results, and they were asked to predict the likelihood of pneumonia or heart failure or chronic obstructive pulmonary disease. So first they were shown two cases which had no input from AI for creating a benchmark. Then they were all randomized and the AI input assisted reports were given. The accuracy when the AI input was not given was 73%. Now with the AI model input, the accuracy went up by 2.9%. And when a AI model explained how it arrived at certain decisions, then the accuracy went up by 4%. So in the next experiments, the AI models were made to provide intentional biases. So in that case, the accuracy dropped by almost 11.3% without AI input. And with AI input, AI said why there is irregularity and it explained the reasons for irregularities. Even then, the accuracy fell by 9.1% below the baseline. So this study shows how important is the explainability factor. So when you're establishing standards, policies, you need to factor these mechanisms to monitor, track biases, explainability, trustworthiness, and very importantly, accommodate human oversight for the AI responses. Another important factor to consider is adherence to regulatory requirements. So it is mandatory for a pharma company to indicate confidence score for a case narrative generated by LLM as per good automated manufacturing practices requirements. You need to assess the impact of AI acts like EU AI Act for its implication on selecting the models, right? And the organization needs to establish strong practices to adhere to data privacy requirements and ensure the redactions, application of differential privacy in data sets, anonymity in the data before training the AI model or the ML model. Because erasure of private data comes very costly if it is not factored in the process. So when we talk about AI, these governance mechanisms need to be applied at data engineering practices as well. Because the AI, the fundamental, it is based on the underlying data.